Hey, friend. Can you hear me, Mel?
Look at us in this space. How exciting.
Oh, look at you in red.
Yeah,
We're matching Jeremy.
we
Oh,
are.
you're matching.
Hey, well, you better get it. Let's go.
We can't
Awesome.
hear you, Mel.
Yeah, we can't hear you now. All right, I'm gonna step out right quick. I'll be right back. I'm gonna go get my printer.
Okay.
Can you hear me now?
Yes.
Yes, ma'am.
Cool. The flyer's good, Jeremy. I was able to put it on the slideshow.
Oh, you were? Thanks. I don't know.
Yeah, thank you.
I'm supposed to be an attorney, guys. I'm not to make graphics, so don't hold me accountable for their
Oh,
uh
that's really,
No,
really
it's
good.
really good. Yeah,
Like the fact that you just made that up like right
I
now.
know.
Really,
Mhm.
really good.
are y'all drinking any coffee this morning?
Of course.
Mm. My nutritionist wants me getting rid of all like everything bad. So I can only drink what are they called? Oleatos. So the olive oil coffee drinks. Like this one has avocado oil in it, but it's whatever.
Yeah.
I know. I miss my like 200 gram of sugar thing from Starbucks.
Who's Cynthia? Is she a senator? Morning, David.
Hey, good morning, everybody.
Hey, Mel. She's talking.
Maybe in another life you want someone else. Show me so
Good morning, everyone. Hopefully everybody can hear me. You can't hear me? No.
I can hear you. yeah.
Oh, okay. I was like,
It's just it's low on my side.
okay. I'll just enunciate. Good morning.
Look at
everyone.
you in baby blue. So
That's
pretty.
it.
Yes.
If all else fails, use a Bridgerton voice. I'm sure we'll shock them.
I'm gonna set up the sound and stuff.
Okay.
It's not moving, right?
No, man. Bienvenidos.
Wait, is that Canva?
Yeah, yeah.
I
Canva.
did not, yeah, I did not know that Canva can do that, like
Yeah.
presentation.
Oh, yeah.
Yeah.
Interesting.
Did this have audio?
Also do videos. Yeah.
Oh, nice.
See, you do learn something at Staff Senate.
Yeah, you do.
I learned.
Melanie, did this have video, audio?
Yeah, I'm about to reshare with audio.
Okay, just curious. Thank you.
Actually, I learn every time we have a speaker. They're great.
Loud, what's how's the volume?
It was loud and then it went like really low.
Too loud? Is it good enough or too loud? Is this not the vibe?
It's making Jeremy laugh.
Thank you. I needed. Oh gosh, guys. Tomorrow I interview for. I have my physical test to be a police officer.
Ooh,
How
exciting.
exciting!
Wow.
But
Well, I hope everything goes well.
Good
Yeah.
luck.
I know who to call if I get a ticket.
not on a recorded line, guys.
Good luck tomorrow.
Oh my god, that
Great.
is so exciting. Is it too loud? Okay.
Okay, I'm gonna go ahead and admit everyone in, okay? Good morning, Nina. I see you. Good morning, Dr. Bello. I see you. Good morning. Good morning, everyone.
I didn't realize I was on mute.
No worries.
Will you be sharing the slides or do you want me to share them?
If you can share them, we can give you co-host abilities while we get
Okay.
started in a little bit.
Okay, let me pull that up. Thank you.
Good morning, Ella.
Morning.
Good morning.
Good morning.
Enter a prompt here. Okay, can't be that hard. How about generate an image of a cat playing guitar?
Good morning, everyone. I call this meeting to order at 9:03 a.m. We will proceed with roll call with Mr. Secretary David Guerra.
Good morning and thank you. I will now begin roll call. Staff senators, please indicate your attendance by stating aye in the Zoom chat or out loud in the call. Here we go. Oliver Lozano. Claudia Garcia. Cristina De Leon. Cristina Rodriguez. Dina Guerra. Dina Lopez. Mireida Torres Avila. Juan Miranda, correction, Jaime Miranda. Jake Gonzalez. James Martinez. Jeanette Garcia. Jeremy San Miguel. Jose Amieva. Caleb Buenteo. Crystal Chapo. Leslie Orozco. Maribel Mata. Myra Garcia. Melanie Garza. Alexis Ochoa. Monica Granado. Omar Nedzelski Jr. Rolando Segovia. Timothy Odoms. Travis McAlpine. Van Slusser. Veronica Villarreal. Yesenia Carter. Madam President, roll call is complete with the number of senators present. Quorum is established.
Thank you so much, Senator David Guerra. Good morning, everyone, and happy Thursday. Welcome to our Staff Senate General Meeting for June 2024. This is our last meeting for the fiscal year. It has been a pleasure being with you today and this year. So we'll get started with our new business. Is there a motion on the floor to table the meeting minutes for April and May 2024?
I move to table the minutes for April and May of 2024.
Is there a second?
I second.
All those in favor, please state aye in the Zoom chat. All opposed? Any abstentions? The April and May 2024 meeting minutes have been tabled. To our first guest speaker of today's meeting, we welcome Dr. Fatima Bello. Dr. Bello, can you hear me?
Yes, I can hear you. Trying to
Okay,
share my screen. Yeah.
thank you.
Thank you.
Be-
Good morning, everybody. Yeah,
Good
go ahead.
morning. I'm so sorry to interrupt, but before, once you finish your presentation, if you can give me back the host abilities.
Sure.
Okay.
Yeah.
Okay, thank you.
Thank you so much. Okay. Hi, good morning, everyone. My name is, thank you so much for joining and thank you for the very nice invitation. When Veronica and Crystal had reached out to me, I didn't even know there was something at Staff Senate, but it was very nice to be acquainted with it. But thank you so much again. My name is Fatima Bello. I'm currently one of the physicians here at UTRGV. I'm an assistant professor. I'm also the program director for the UTRGV NAP Medical Center Internal Medicine Program. A little bit about myself. I'm originally from Nigeria. I went to medical school in Nigeria. Then afterwards, I moved to the United States for graduate education. Started out in Boston, got my MPH degree from Harvard. Then went to University of Alabama at Birmingham. I started doctoral program there, but I did not complete it all but dissertation before moving to the RGV for my residency at DHR. And since I completed my internal medicine residency at DHR in 2020, the RGV has been my home. So I'm very excited to be here. And it brings me so much joy when they ask my kids, like, where are you from? And they say, I'm from Edinburgh. You know, it's always a thing of joy. So I wear different hats with UTRGV. Like I said, I'm the program, sorry, let me move this away. Oh. Okay. Sorry, I'm trying to move this out of the way. Okay, so I'm the program director for the Internal Medicine Residency Program, and Internal Medicine Residency is a branch of medicine that medical students usually pursue once they are done with medical school. So it's 3 years of additional training after medical school, and there are several programs here in the Valley. I'm the program director from one of them. So this is the current graduating class that just graduated this year, but total residents, we have 36 residents, 12 per class. For this cohort, we have like 6 from the Rio Grande Valley. About 70% of all our residents are Spanish speakers, and we have about 12 to 13 countries represented as well. So another part of what we really do here at NAP, and also as part of the mission of UTRGV, is we try as much as possible to engage the community that we serve, because we're here because of the community. We're here to improve patient care. And one of the things that we actually really do with the UTRGV program is to try and reach out as much as possible. So I have a few pictures here and there to show some of the things that we've done or that my team has done as part of the program. We've tried to educate the West Laco Police Department. We've also gone to a few schools in the West Laco area, and it's always so fulfilling to go into those schools and you see all those young kids ask us questions. Some of them are like, "Oh, I want to be a physician, but I've never seen a physician that can, explain these things to me before." So it's always very fulfilling and very gratifying to do that. Recently in May, I also received the mental health proclamation from the mayor of West Laco, and we've also been to the rehab facility here to educate patients and also do Facebook Live events. We were also part of the recent winning. There was a little reception from NAP Medical Center when the Lady Panthers won. We're also a part of, we've just, as much as possible, we just try to be involved in the community as much as possible. And from what I've heard, that has made a lot of difference as well. Something else that we really do as part of the team is part of the internal medicine clinic program is the clinic. So we do have a UTRGV clinic here at West Laco, and this is one that I really wanted to share with everybody today because it's just this little nice clinic in West Laco that I feel like a lot of people are not aware of. We're just on 1330 East 6th Avenue, and I'm going to share the address later. And we do provide a lot of services there. So like I said, it's a primary care clinic. Primary care is the foundation of the healthcare system, and it plays a crucial role in promoting health, addressing preventive diseases and maintaining a healthy lifestyle. So a PCP is a physician in that primary care clinic that serves the patient and is usually the first point of contact. And so many studies have shown that, having a primary care physician actually improves your health. And it kind of makes sense because you have somewhere to go, and you have like a physician or somebody you're talking to if you have any issues with your health. So recent studies, this is from something that was recently published by the Commonwealth Fund. It shows that unfortunately US adults they looked at like all the very wealthy countries across the world, and US adults are among the least likely to have regular doctor or place to go for care. So comparing, from Sweden, we're doing a little better than Sweden, but if you look at like all the other countries, that's a huge area of improvement and so that we can do. Similarly as well, US adults are the least likely to have a long-standing relationship with a primary care provider, and US adults are also the least likely to be able to see a primary care provider after regular office hours. So, and also to further buttress that, so comparing the US to Japan, so for the adults in the US that go to see a physician, averagely, like 4 times a year. But in Japan, they have like more frequent visits. Like they can go for like anything. Oh, I have like this headache. I woke up overnight, I had headache, or I had like some sinus congestion and all of that. So they're averaging about 13 visits per year, which is much more than, what currently the US offers. So again, primary care physician, like I had said earlier, where doctors, internal medicine, for example, there are different branches of medicine, but I'm just going to focus on internal medicine for now. So internal medicine doctors after medical school get additional 3 years of training. Sometimes after these 3 years of straight training, some people decide to also get some additional training. But for the primary care ones, they just basically focus on internal medicine. But during their time in internal, it's a rigorous 3-year training, and they get to do all these rotations. They rotate through like nephrology, pulmonary, like kidney, hearts, basically all the organs that we have, just so that they have that training to be able to help people, like to care for people once they graduate. So it's a very rigorous training, a lot of time spent rotating in all this variety of subspecialty clinic where they gain experience. So what can a primary care physician do for you? So a primary care physician can help you establish a medical home. And by medical home, I mean, if you look at it like somewhere where you can just go to all of your care, after seeing like a physician for so long, like we call that continuity of care, we want you to establish care and see somebody that gets to know you over time, knows your family history, knows your allergies, know like what you can, basically knows everything about your health. And that can help you to facilitate should in case you need like referral to somewhere else, or they can help you to coordinate your care. So that's kind of what we call the medical home. So a primary care physician can help you do that. A primary care physician can also help you monitor your health, see how things are going. So for example, blood pressure issues, very common in our community here. Also diabetes, for example, is also very common. So a primary care physician can help you with that. We can also help you focus on preventive care and healthcare promotion. Early detection is also something we follow, like the guidelines, we use as much as evidence as much as possible. But that is not to say we try to individualize care as well, because sometimes we know like it's not a one size fits all. Some people have like a family history of something, and because of that, they want to be more careful. Maybe they want to do like extra testing or whatever you need to do, we're able to like meet you there. But early detection is what the US CDC is focusing on right now, because we've all heard of all of these increasing cases of like breast cancer in the young, colon cancer in the young, and all of that. So we are trying to also do a better job with focusing on early detection and intervention. We can also help facilitate care to specialists. Sometimes you're seeing we do the primary care, but sometimes you need like an additional care. So for example, it's possible like we diagnose with you asthma, but we also want you to follow up with like a lung doctor that just focuses on your lungs. So we're able to like facilitate referral to specialists. I also kind of touched on the preventive care earlier, but I can stress that it's super important for everybody to kind of focus on their health and also promote health and well-being. We're also able to provide comprehensive care, acute illness and chronic illness. And specifically, I want to highlight here that, so we have a primary care clinic just in front of the hospital at NAP. So we're just like 1 minute away from the main hospital. So I'm right here at NAP, but the primary care clinic is just like 1 or 2 minutes away from me. So we have easy access. We're able to like, if anything, for example, if we see a patient in the clinic and maybe like for the blood pressure is too high or something, or they're having some acute symptoms that we have to admit them for, we can just like facilitate the transport of that patient directly to NAP Medical Center. So it kind of like makes for easy sign off, easy handing off, and we have the same team. So we have like the same team of UTRGV NAP residency in the clinic. We also have them in the hospital at the same time. And we do have 24/7 coverage. Here we have like in the hospital and also have care services in the clinic. We do have a dedicated service answering line that kind of, you can talk to somebody because we have residents, like I said, on call 24/7. So you can talk to them directly any time of the day if you want to. So some of the common conditions we treat, I just tried to put together a few here and there. But we are able to do like the sports and school physicals, yearly physicals, health screenings, the urinary tract infections, the sinus congestion, ear infections, and all of that. Also chronic conditions, diabetes. I would like to mention diabetes is one of the areas where we focus on in the clinic, and it's just because I'm sure you're all aware the RGV is very well known for the diabetes, amputation, and all the complications of diabetes actually. So we are trying to also keep an eye and be more proactive with the diabetes management care that we offer in the clinic. High blood pressure as well, high cholesterol. We also have like some of the physicians that are trying to get certified in American obesity medicine, so they can provide evidence-based care. But basically we're able to, like most of the common conditions, we're able to see them. And if we need additional help, we're able to like facilitate referral to a specialist if needed. okay, men health issues as well, women's health issues, menopause, BPH, urinary incontinence, erectile dysfunction, mental health issues I also like to talk about. We are able to like manage like the, you know, anxiety, depression, but sometimes if needed, or if there are like some other comorbid things, like, you know, if the patient or the client has like additional need to refer to a psychiatrist, we are also able to do that as well. These are some of the physicians. I cover the clinic sometimes, but these are the 3 physicians that will be in the clinic, you know, all the time. And anybody, we also have residents there, but the physicians also have their faculty practice. And basically that means that, so sometimes you can say, oh, I only want to see, like, for example, Dr. Chang is the one on the left here. This is Dr. Chang, and you can always request, I only want to see Dr. Chang today because, you know, I know how, you know, whatever I prefer, how, you know, something. Dr. Solis is also another physician that is there, and Dr. Daniela Hernandez as well, and they all speak Spanish. I also see patients in the clinic as well, like I said, but they are the 3 people that are primarily there. And if you're open to it, we also have residents that are there. But even if you are seen by residents, definitely you will be seen by a physician on top of that as well. So you have 2 options, right? You can either be seen by the faculty, like the Dr. Chang, Dr. Solis, myself, or Dr. Hernandez, or you can be seen by like a resident. So Dr. Chang is one of our residents, for example. You can be seen by him. But if you're seen by him, you will still be seen by like one of us, you know, because they are residents and they are still under supervision. And we see adults 18 years and over, and we have walk-in, we don't have any wait times at all. So when I was looking at the statistics I described earlier, that people have to wait a lot, or like people do not have where to go for their primary care. In my mind, I'm like, we're here, you know, just here in West Laco, we have all the services, but I feel like sometimes people are not aware of some of the services we have in the community. We do not have any wait time, or if anybody has any issues with wait times, I'm happy to chat, or if just let me know and I'll be able to get you in on time. So this is where the clinic is. This is the address of the clinic, and that's the number of the clinic on the screen. And I have my email there as well. Happy to chat if anybody has any questions, or if, you know, if there are any thoughts or any comments, I'll take them. But thank you so much for the invitation again, and I appreciate it.
Any questions for Dr. Bello? Dr. Bello, I have a question myself. I'm not sure if it was in the slides and I may have missed it. Do you have like the days and times that the clinic is open?
Yeah. Oh, I'm sorry. Yeah. So we are open 8 to 5.
8 to 5. Okay.
Correct.
Okay. And then is there any weekend hours?
So we do not have, currently we're not open on the weekends. But if you've been seen, you know, Monday to Friday, and you have like an issue over the weekend, then we're able to, like, you know, if you need refills, for example, you know, we're able to like call in the refills for you over the weekend. And if it's something that cannot wait till Monday, then we're able to see you in patients in NAP Medical Center with the rest of the team.
All right. It's very informative. I appreciate
Oh, no, thank you.
the time to kind of come in and give us a breakdown of what is on the community.
Thank you. So I think I gave you back the hosts, but let me. I'm not sure how to.
On the top right corner of my name, you can give me, it'll give you the option.
Okay,
to
make
back
host.
up.
Yeah. Well, thank you. Thank you so much.
Thank you so much.
Thanks. Bye-bye.
Bye. Up next, we do have Miss Nina Barrientos. And see, I am gonna probably butcher her last name, Chowdhury. Presenting for the Employee Benefits and Wellness Fair.
Hi, good morning, everyone.
Morning.
So if you could just make me co-host real quick, I'm just going to share our flyer. Hope everyone is doing well. Can't believe we're already gonna close out another fiscal year. We're like a couple of months away. That is just so crazy.
It went by fast.
Not just the fiscal year, but I also feel like we're midway through an actual calendar year. I feel like we just started a new year. Like it still feels like January sometimes.
I blinked and we're here.
Yes, exactly. Okay, so you should be able to see my screen. So this isn't really a presentation, it's just an announcement. So Simi and I come, of course, from the Office of Human Resources, and we just ask you guys to just save the date for our upcoming benefit and wellness fair. So annual enrollment is just around the corner. If you were to scan the QR code that you see on the screen, it's going to take you to our 2023 fair, but I promise you that website will be updated and live by the end of today. It's the same exact link. It's just going to be updated shortly. With the fair, we'll have service providers who will be coming in to provide presentations, such as like we'll have the Office of Employee Benefits coming in from UT System. They're going to do sessions on just annual enrollment in regards to your insurance, retirement, as well as wellness programs. We'll have presentations from Chartwells, as well as our wellness partners joining us from our Office of Emergency Management, who's going to cover Ready UT RGV. We'll have exhibitors. We'll have our UT RGV bookstore pop-up will be there as well. We'll have opportunities for prize drawings. So we invite you all to attend one of these sessions in person. We'll be at all 3 of our campus locations. We will have more information coming soon from UT System. So keep a lookout through our communication platforms. We post in UTRGB Messenger. We'll be posting in our Microsoft Teams, the announcements page that's there, as well as our My UTRGB banner. You know, as many platforms as we can get across to, we'll have information available to you. If you have questions, you can visit our website or you can email benefits@utrgv.edu, and we will do our best to respond as quickly as possible. And that's all that I have. Again, save the date. QR code on here will take you to our website as well.
Any questions for Nina? I think we have one question. Are there any noticeable differences between this year's benefits versus next fiscal year's benefits?
That is a good question, and that would be something that either our benefits team can answer at the fair, or you can join one of our presentations as well.
Thank you. Any other questions for Nina? All right, well, thank you, Nina. Thank you so much for coming today. We're going to go ahead and move to the next part of our agenda, which is the committee reports. I will hand it over to the communications chair, Mr. Jeremy San Miguel.
Thank you so much, Madam President. Hello, staff senates. As your communications chair, I'm happy to report there is no new business today. A fitting end to a very successful fiscal year. We made it. I mean, together thinking about all the accomplishments that your departments and overall all staff at UTRGV have done, it's remarkable. And let's not to forget that Staff Senate is here for you. We want to be your voice and advocate, working through work environment improvements, and of course, just to be connected with one another. We do have a marketing form that we really want to push out there. So if you have anything, an event or a program or a service that you would like, disseminated out to the campus, we would love to be your liaisons during that process. And of course, most importantly, if you have any concerns or if there's something that requires immediate attention regarding you or your department, please feel free to reach out to us. We want to grow our communication efforts with you next year, and we cannot wait to launch new programs. That would be it for the committee report, Madam President. Thank you.
Thank you. Up next, we have the Constitution and Elections Committee. Ms. Yesenia Carter will be presenting.
Hello, good morning, everyone. Today's committee report, we are coming up with elections for the Staff Senate. As the terms expire for the current staff senators, new senators are nominated and elected to represent the respective divisions. All full-time, active, classified, or administrative professional employees at below the level of assistant vice president who are not represented by the faculty senate are eligible to vote and to be members of the staff senate. An employee must have 6 completed consecutive months working as full-time to be eligible for the nomination. I'm so sorry, I practiced and reviewed all of this. But just wanted to let you all know that elections are coming up. So we're gonna run the nominations July 8th through the 12th. You might have received an email in error. We apologize for that. We were working on it and we accidentally sent something and it was supposed to be taken back. I'm sorry about that, but the next time you all get it will be the week of July 8th, July 12th. If you all have any questions or concerns, just feel free to either Teams us, send us an email. We'll be happy to answer your questions directly. Only because I don't have the answers right now. But anything you all need, just email us, Teams us, and we're more than happy to help. But yeah, that's all the report that we have for the Constitution and Elections Committee, just that nominations are coming up following the elections. So thank you all for your time. I'm going to pass it over to Mr. Omar Nadzelski Jr.
Good morning, everyone. I'm covering for Omar. He's here, but he's sick, and then I'm talking for the committee. We don't have any new feedbacks. We haven't received anything, but we're still working on the feedbacks that we received last for the last meeting and we presented during last meeting. And we want to encourage everyone, like if you have any concern, you have any suggestion for the institution or any process that you need clarification, please, we had the link in the we had the link here in the chat. Please feel free to send, and we will work as a committee to help you to answer your question or bring that information to any office that required. Thank you. And I'm passing to the Staff Success Committee to Oliver Lozano.
Milea, thank you very much. I guess from our committee, all we can say is it was a crazy fast year, and we're just happy that we got to see some of y'all's faces during some of the events that we had through the fall and spring. There's no report for us this month, but we just hope everybody's enjoying the rest of their summer, and we're looking forward to a great number of students coming in because our number of students are increasing every single semester. So without staff, we wouldn't have students. Without students, we have jobs. But all in all, we're just one single family. You charge me here, and that's my spill of the report. Madam President?
Yes, okay. So I will move to open the floor for public comments and questions.
Alrighty, so we did want to share some announcements from the Office of ODT, if that's right.
Yes, that's perfect.
Alrighty. So by any chance, can I share my screen really quick?
We'll go ahead. Alrighty. You should have co-host abilities.
Thank you so much. All right, so basically, my name is Marco. I'm from the Office of Organizational Development and Training. We're always striving to find ways to not only provide engaging trainings to you, but also some that are practical that you can use in your everyday job. So our newest or greatest and latest that we have right now is the Facilitator Bootcamp. And this bootcamp is basically for any individual that typically does trainings in their departments, that does, constant presentations, whatever the case might be. If you're the de facto facilitator in your department, or you just want to, enhance those skills, I think this will be the bootcamp for you. So in this particular bootcamp, we're going to cover several details, right? Going from enhancing your public speaking skills when presenting and facilitating, and also on, engagement, right? How to engage your audience, because it's one of those things that's kind of sometimes a little bit hard to do, is engaging the audience to make sure that you get that feedback. But also, you know, on top of all of that, because we facilitate now virtually and in person and so on, we're also going to cover the virtual aspect of it. So we're going to see how facilitation and presenter looks also through Zooms and Teams, and you'll learn a lot of, you know, the ins and outs of Zooms and Teams. So overall, a pretty cool, you know, bootcamp that is coming up. It will start on July 31st. It is going to be split into 3 weeks, right? So as you can see there in the flyer, the first session is going to be in person at the West Local location, and then the second will be in virtual so that we can see how the virtual aspect of it looks. And then the last session with closing will be in person again in West Local. Again, really cool. We're going to go all the way in detail to, you know, what's the best way to design your presentation, right? I mean, we're not going to be meticulous of it, but we're definitely going to give you some really cool tips on, you know, what fonts, what colors, and those kind of things. I mean, as a foundational, but most importantly, the speaking and the engagement skills that come with it. So I know that Nicole Maloof might have put the flyer there. So if you're interested, click on that, or you can scan this QR code. Definitely something to look forward to.
I included the link in there as well, Marco.
Awesome. Thank you, Crystal. And now I want to move on to our workshop that we have tomorrow, right, with Dr. Wellborn. So we're going to have a training on civility in the workplace, right? Really important. If you're not too sure, you know, what does that entail? Well, she's going to talk a lot about, you know, the good and the ugly of how we communicate, or how we, you know, just interact with each other in the workplace, right? How that looks, how being civil in the workplace looks, how it affects us positively. On the flip side, how incivility affects us and how it kind of lowers morale and those kind of things. And then finding ways to prevent that, right? To kind of prevent the incivility and how to address it. So if you're interested in joining, you can sign up through the training portal. And tomorrow we're going to have a training on in Edinburgh, ESTAC 1.101 at 1 p.m. So if you're interested, we'll be glad to have you there. And then lastly, I just wanted to mention briefly of our services in coaching, right? So if you feel that you're in need of some coaching, right, which is a little bit different than mentoring and coaching, it's a little bit more, I guess, based on your goals and more strategic going forward. But nonetheless, we do have coaching available at UTRGV. So if that is something that you're interested, know that that is a program that is now being offered free of charge. The current coaches is Dr. Garza, Beta Reeves, and Nicole English. And here soon, we will have 3 more in the near future. So if this is something that you're interested, you can just go to UTRGV coaching and you can, you know, fill out the form. And again, coaching, it can be beneficial just to kind of enhance your professional development, which as a proxy, it enhances your personal development as well. Yeah, that's all I had to share. I thank you all so much for your time, and Staff Senate for giving me the time to be able to announce this.
Thank you so much. We do have a question. Any chance that a facilitator bootcamp will be done? Okay, yeah, that was answered. I think it was remotely instead of in person.
Yeah, so it'll be a hybrid this first time, and then we'll see after that how it goes.
Okay, great. Any other public comments? Questions? Just checking through the comments. I'm not sure if I missed anything.
Madam President, I just want to say thank you for your year as our president and Staff Senate. Thank you so much. You've accomplished a lot as your year as president. I just want to say thank you. And you taught me a lot in Staff Senate. So just thank you for your year. And yeah, thank you.
Thank you.
I didn't want to I didn't want to make you cry. I'm sorry. I just want to
Thank
but thank
That's
you.
really sweet of you. Any other comments, public? Else? If there aren't any further public comments or questions, we will now move to make a motion to adjourn.
I do have a public comment. So I just wanted to say thank you to all staff senators. If this is your last staff senate meeting, if you're rolling off. And welcome new people and those who are getting nominated and who will start with us in the new academic year. So yeah, good vibes.
Sure. Also, if you're not sure whether you want to be nominated, please feel free to reach out to Staff Senate and ask us what's all about, what the responsibilities are, just the camaraderie behind it. Please feel free to reach out to our email, and we're more than happy to sit down with you to see if this is the best fit for you as nominations are going to be happening. Any other public comments? Questions? Okay, if there aren't any further public comments or questions, we will now move to make a motion to adjourn.
I move to adjourn the Staff Senate General Meeting for the month of June.
Is there a second?
I second.
Is there any debate or discussion? Is there a debate or discussion? Debate or discussion? All those in favor, please state aye in the Zoom chat. All opposed and any abstentions. Alrighty, we will adjourn at 9:41 a.m. Thank you so very much for joining today and have a wonderful rest of your week.